Okay, here we go. Hope you're enjoying the series so far. Level 3 Anatomy and Physiology, and this is the start of another subject. And we're going to be looking at the core and postural stability. And how we talked about in the last unit, where we were sort of chatting about PTs really making their money and being able to become a high quality trainer. This is another one of those areas, okay? If you can be helping out your clients with their core and postural stability, you're going to be helping them to improve their health. You may have a client who wants to run a marathon, who wants to gain 6, 7, 8, 9, 10 kilograms of muscle mass, whatever it might be. But if they haven't got a solid core and a good posture and they can't walk around without pain, then all of those other goals are going to go away, and it's going to become about making them pain free and helping them move better and more efficiently. And the PTs that can do that, whilst they're helping people to meet their goals and keeping them injury free, are the ones that are going to be the most successful. So the learning objective is to understand postural and core stability, and in particular during this unit we want to be able to describe the structure and function of the stabilizing ligaments and muscles of the spine. So I know during the last unit we looked a little bit at the pelvis, and in particular the bones and the ligaments that make up the pelvis. And here's a quick bit of revision, okay, because it does normally come up on the exam. So pelvis is really part of the core, and these are the bones that we looked at last time that you should be aware of where they are, and in relation to the pelvis, are they at the front, are they at the back, where are they? We also looked at these ligaments, and we looked at their relationship to the bones. So whereabout are they, and which bones are they interacting with, and which ones are they located next to when we look at the pelvis. But the main point of today's lesson, which is quite a short one, alright, is that we want to be able to understand some more about the spine. And we covered this at level 2, but I'm going to quickly recap it for you, okay? When we look at the spine, we have these 5 regions, okay? We have cervical at the top, then we have the thoracic region, then we have the lumbar region, and at the bottom we have the sacrum and the coccyx, alright? And the sacrum and the coccyx you can also see just the bottom coming down underneath here as well. But what you need to be aware of is a little bit more information. So as well as knowing the regions of the spine, you need to know what order they come in, and you also need to know this information here, okay? In particular, the number of vertebrae that are in each of the different regions. So we have the cervical first of all, and there's 7 vertebrae in there. And really what the cervical region does is it has the smallest vertebrae, and it facilitates the movement of our head. So if you want to twist, if you want to look like you were crossing a road, for example, then that's what the cervical region helps us to do. It helps us to maneuver our head and be able to twist and to look around. And it also contains a larger and greater number of openings, also known as foramen, which we'll look in a bit more detail on the next slide, to accommodate nerves and blood vessels. Right then. Then we have the thoracic region, which that makes joints with the costal muscles, and is capable of relatively more rotation than the lumbar vertebrae. So if you imagine twisting your spine, the majority of that rotation is coming from the thoracic region and the 12 vertebrae in there. It's not coming from your lower back, which is your lumbar. It's coming from your thoracic, which also makes the joints with the costal bones, alright, to keep us nice and strong and protected around there. Alright, lumbar region. So this is your lower back, essentially, and this is where the big, really, really strong vertebrae are. And what this part is capable of is flexion and extension, alright, and also a little bit of lateral flexion. And, if you were to push your hips forward, okay, push your hips forward, that movement, although it's the glutes that the muscle are responsible, it's the lumbar region that needs to be more flexible to allow that to happen. And Our lumbar region is probably the most area that's most prone to injury. You know, you will I'm sure you've all heard stories about people getting lower back injuries in the gym, you know, or having lower back pain from sitting in an uncomfortable position. That's normally going to be coming from the lumbar region. And, you know, any of you that work at a desk for long periods of time or sit in an office chair have probably heard of chairs and whatnot that have lumbar support. And essentially all that's saying is some part of the chair that's going to support your lower back. So that can also be a good way to remember where the lumbar region is. And there are only 5 vertebrae in there. We then have the sacrum, and underneath that we have the coccyx. All right, the sacrum has 5 vertebrae in there, and it forms a joint with the pelvis, which is normally fully fused by the age of 30. So, you know, you might think you're fully grown by 18, or sometimes even, you know, a little bit less than that. This joint is not normally fully fused until the age of 30 years old. Then we have the coccyx below, which also has 4 vertebrae. It's the lowest section in the vertebral column, and again, that's normally fused by the age of 30. So if we just look a little bit again, sacrum and the coccyx, which are down here, okay, they're the bits which are going to be fusing in with the pelvis to form the joint there. And this, okay, this is what an individual vertebral disc looks like, and we need to understand a little bit more about these individual vertebrae. And what the diagram shows is, if you look at the front, you've got the main vertebral body. So, you know, this being the front, this side here, that's your main vertebral body. And essentially what that is, it's a cylindrical bony disc. And what this does is it provides surface for the intervertebral discs to attach to them. And these form the main cartilaginous joints of the spine. Okay, so these are the intravertebral discs here. So when you hear someone saying, no, I slipped a disc, this is what a disc is. And those are the discs that sit in between the circular bony bits that make up the spine. If we look at the back of the spine, we've got a series of what we'd really call bony projections. So bits that poke out. So, you know, looking at these really pokey out bits here, and those are the bits, you know, if you run your hand down your back of your spine, those are the bits that you'll be able to feel. You know, we're talking about the back of the spine here. And what these do, the easiest way to describe it is they interlink with, best way to explain this, they interlink with the sort of adjacent vertebra to form essentially synovial joints, and a series of openings or foramen, which we mentioned earlier, which puncture the vertebrae, and they allow the nerves and blood vessels to flow through. So your foramen is here, so the big gap, and what that gap does is that allows the nerves and blood vessels to flow up through the spine. Okay, we have the discs, which I know we covered, but just so you go, the discs give us a little bit of movement in our spine and ensure that sort of like we can manage load and take load, and that's what the discs do. And then the reason these bits are all pointed at the back, that's for protection, because, you know, we want to be able to protect our spine. And, you know, if you imagine just behind these, the bits that sort of poke out, you've got all our blood vessels and nerves cord running down there. We need to protect that, so this is nice and bony and pokey and sort of whatnot, so that we can keep those blood vessels nice and protected. I guess just to give you a bit more information about the intravertebral discs, they're like a sandwich, really. So if you imagine these two bits of bone being the bread, the disc is in the middle, and it's the sandwich, and they're made out of fibrocartilage, so essentially cartilage, like a bit like a shell-like cartilage, and the sort of the shell-like bit surrounds the bit in the middle, which is more softer. Really, it's a bit like a gel. And if you have a read of the manual, you see it describe the gel bits like like a heavy phlegm. That's not the best, or a little bit of a weird way of describing it, but that's what's in the manual for this one, and it probably is a real good description. And what the discs do, as we touched on earlier, they're going to be absorbing shock, but they can be vulnerable to injury if the back's excessively loaded with poor alignment. So, if you're doing loads and loads of squats and you've not got the back in the right position, they're prone to getting injured or slipping out. Same thing, if someone's working on a building site and they're loading their back up all the time, carrying sacks, whatever it might be, the discs are going to be more prone to injury. But big takeaways here are being aware of what the different parts of the spine are, okay? Especially the foramen, and we have the discs that are sandwiched in between those two pieces of vertebral bone. Spinal anatomy is something that I'd like to touch on and talk about a little bit more. The reason being is what I touched on at the start. This is how a lot of people, a lot of PTs make their money, and postural, anything around sort of surrounding the postural area can be difficult. It does take practice and skill to be aware of exactly what's happening. And you could look at doing another one-day course, or you could look at potentially going and doing something like a CHEK qualification, which is the guy who's mentioned in this quote here. But if you can ensure that your clients are moving safely and efficiently, then you're going to be doing them a whole world of favours. But it's sort of, if we look back at the last slide, what we're kind of saying is that if we do movements with the spine in a poor position, it's more likely to suffer some injury. And in order for us to sort of know what the spine is meant to look like, we need to understand that the optimal way for the spine to be lined up at, or what we call a neutral spine, all right, is when there's no load on the spine, so we're not in a position where we're picking up any weights, and there's three major curvatures in the human spine, and we'll talk about those now a little bit more. So if we look here at the cervical region, the spine's curving inwards. We look at the lumbar region, the spine's curving inwards, and we look at the thoracic region, and the spine is curving outwards. All right. So just to break those down and give them their sort of real correct terms, the curves in the lumbar region and in the cervical region, all right, they are what we call concave curves. So that means that they're essentially concave, means that they are curving forwards. And then this one here on the thoracic region, which is curving out, all right, what that is known as a convex curve. So we have convex and we have concave. Convex is for the thoracic region, concave is for the cervical and the lumbar region. And sort of says, as I was talking about, it's difficult to identify, but what you're looking for is this nice, natural, neutral spine with the two curves in it. And there's this guy, his name's Paul Chek. He's really, really famous in the PT community, and he runs his own sort of PT courses, but he's a real expert on posture and human movement. What he suggests, if a line can be dropped vertically from the ear, through the middle of the shoulder, and hip to a point just in front of the ankle, then posture is probably ideal. So if there's a straight line essentially going from the ear, through the shoulder, through the hip, and just to the front of the ankle, then you know someone has got ideal posture. If you're looking at someone and you're dropping it down, dropping down from the ear, it's not going through the shoulder, straight away they've got a problem, that they're not lined up in the correct way. If you drop it down and it goes through the ear, it goes through the shoulder, but then the hip's not in line, then there's a problem going on somewhere with the hip, and the hip's not quite in line with the rest of the body. We need to look at that hip a little bit more to see what we can do to get it back in line and to get it functioning in the correct way. Okay, and as we can see, as we grow, when we're a little baby in the womb, we have one curve, all right? However, as we grow, as we get older, the spine then develops and it has three curves. And we've just looked, in particular at the convex and the concave and where they fall in terms of the human spine. And just to recap, in case you weren't aware, it's the concave, all right, is at the cervical and the lumbar, and the convex is at the thoracic. So if you were to look at this baby's spine, okay, the baby's spine really is only bending convexly, just bending like that, like a letter C, convex. But these concave ones come in once we get older and once the spine starts to develop a little bit more. So what you should have now is a greater knowledge and function of the spine and the stabilizers and the bones that make up the spine. Be aware of those, in particular the diagram where we broke down the spine and looked at the individual bones and the discs that were in there, because that does normally come up on the exam. Hope you enjoyed this one. Please go on, have a look at the next instalment, which will continue looking at posture and the spine, and I'll see you there.